disorder clinic. I'm a doctor, Dr. Mark. I can tell you any sleep disorder you might have just from the symptoms. And we're actually doing it about sleep, obviously. And sleep takes place in the hypothalamus of the brain. And that's pretty much where sleep takes place. And it also controls other functions, such as hunger, thirst, fatigue, and body temperature. So these are the patients, and I'll call them one at a time. First one to come in. Hi. This seems to be a problem.
I seem to have a lot of trouble sleeping during the night. I wake up almost every hour, sometimes don't even sleep. During my days, I could pass out anywhere. Very drowsy, get headaches, kind of loosening a little bit. So not sleeping good, that might be the deal. Get really irritated easily, and I feel like my mood changes go up and down. Headaches during the day, I don't know what to do.
Well, it sounds to me, it sounds like you have insomnia, which is basically having trouble sleeping at night, which could cause very bad problems during the day. So for you, I would probably try relaxation therapy for about 30 minutes a day. And if that doesn't work, you do have some pharmaceutical treatment. So I'll write you a prescription, but you don't have to use it. If you feel as though you need to, you can.
So I should try the relaxation, then go to the...
If that doesn't work, then you can try the prescription, okay?
Thank you very much. Hi, Doctor.
All right.
I'm having a problem. I don't always realize this. It's something my husband has pointed out. He says he can hear me not being able to breathe, and for a second at a time, and I snore at night. He thinks it's why I wake up at night a lot. Sometimes I gasp for air when I wake up, but it doesn't happen all the time. During the day, I feel like I got no sleep, and I'm always tired.
It sounds to me that you have sleep apnea, which is the closing of airways for a short period of time in the middle of the night. And sometimes, most of the time, usually not serious, but more than likely you can get something that would open up the airways, keep them open, which is a CPAP. Or if it's severe enough, surgery would be an option, but I don't think it would be in your case. And you do look a little overweight, and obesity is sometimes a cause of sleep apnea, so I would advise losing some weight.
I like that. This is like ridiculously hard to move. You don't understand. It's so awkward.
Doesn't matter what I'm doing or what time it is, I just randomly fall asleep. And I'm wide awake at nighttime and I don't get tired at all. I really don't have any muscle control. And when I'm sleeping, I really can't move.
Sounds to me like you have narcolepsy, which is pretty much, in layman's terms, falling asleep at any period of time, any period of day. Sometimes it's not very dangerous, depending on what you're doing. It could be very dangerous, such as driving. So for you, you could take more naps during the day. Whenever you find time, you can just take a short little nap. You want to avoid heavy meals too, because that could be a very big cause. And you also have some pharmaceutical treatment. I will write you a prescription. And if you feel as though you need to use it, you should. But try the other ones first. Try taking more naps and avoiding heavy meals, okay?
Thank you.
Thank you.
Hi, Doctor. I've been having this problem where I wake up in the middle of the night and I'm still sleeping, but I'm like talking, not making sense, moving around, doing things, and I'll wake up and I'll be like downstairs in my kitchen and I don't know how I got there. And if my family wakes me up, they say I'm really groggy and I'm really disoriented. So I'm wondering what's going on, if it's dangerous, and if my family should wake me up or just let me know.
Well, first off, it sounds like you have somnambulism, or more known as sleepwalking. And there is a myth where they say you should never wake up somebody who's sleepwalking. That's not true. You can wake them up. Nothing serious will happen. A slight chance, maybe they could have a seizure, but it's not very likely. But more than likely, it'll just be drowsy.
It's like a 5% chance.
And if you don't feel like you don't want to wake them up, you can just leave them back into bed. Put them back down, but you don't even have to worry about waking them up. Now, the way you can fix that is you have to try to at least 8 or 9 hours of sleep. the best way for that. But if you feel as though that you can't, for any reason, then there is pharmaceutical treatment. And if you can't get 8 or 9 hours of sleep at night, try that, okay?
Thank you.
Damn, Mr. just giving out pills left and right. Just giving out pills left and right.
Hi, doctor. I'm not sure why I've been waking up with headaches and muscle pains in my jaws and my joints, and I've noticed some fractured teeth and some tooth wearing. Do you know what's wrong with me?
Well, it sounds like you have bruxism or teeth grinding. It's not very serious, and there really is no pharmaceutical treatment for that. But you can get a mouth guard, which would protect your teeth at night. Even if you continue to have teeth grinding, it will protect you. Or you can get psychotherapy, which could help you stop altogether. But I think for safety reasons, you can just get a mouth guard. So even if it does continue, you don't have to worry about it.
Thanks.
This character.
Seems to be the problem with it, sir.
Well, something I noticed is about like past year, year and a half, I've been waking up about 2 or 3 hours after falling asleep, just screaming, sweating, pulling my hair out, scaring my dog, just can't catch my breath. It's not like a normal nightmare, because whenever I wake up, I never remember anything.
Took you a year and a half to come here for that. Well, it sounds like you have night terrors, which really isn't bad. I mean, most of the time, the best thing you can do is wait it out, because really the person that's not having it, such as like, say, your family members that come in and hear you, it's more them not doing anything about it, because it doesn't really affect you anyway. They can just wait it out, nothing will happen. And I mean, there are some pharmaceutical treatments if it's needed. If you feel as though you would need them, I can write you a prescription. But I mean, as far as that goes, just make sure that people don't have to do anything about it. So if you feel as though you need that, you can take it. Okay. Now, I want you to do everything that I told you, and come back to me in 2 or 3 weeks and let me know how it all went, okay?